If our actions inspire others to dream more, learn more, do more, and become more, you are a leader. President John Quincy Adams. Welcome to the Guyana Dialogue. I'm your host, Shamiza Ali. Good evening to everyone joining us on Facebook and YouTube. Our topic tonight is modernizing healthcare at Georgetown Hospital, Corporation, and throughout the country. The Guyana Dialogue is being sponsored by a coordinating council of Guyanese based in the US, UK, Canada, Guyana, and the Caribbean. Funding support is by well known philanthropist Dave Narine from Dave West Indian Imports. Please welcome my moderator for tonight, Dr. Tara Singh.
Welcome to our
Good
viewers.
evening, Dr. Tara.
Good evening.
Our panelist is Dr. Ganga Ramdas and Dr. Ramkisoon. Our guest tonight is Senior Advisor at the Ministry of Health, the Honorable Dr. Leslie Ramsammy. Good evening, everyone, and welcome.
Good evening.
Dr.
Good
Tara,
evening.
please go ahead.
Yeah, good evening. Thank you very much, Samiza. Dr. Ramsammy, we want to welcome you to this program. We know you're very busy. You have a hectic schedule, as all the other ministers of government. And I also want to welcome Dr. Ganga Ramdas
Thank you.
and Dr. Sanjay Ramkisoon, who you might know, Dr. Ramsammy. He's a heart specialist in New York here. And Dr. Ganga was formerly the head of the Department of Economics and International Relations at Lincoln University, Pennsylvania. Before we start, I have a very much neglected area in healthcare, and I know you're always on top of it, but I think the population and viewers should know about this. If you can begin this by just talking a little about longevity or lifespan in the PP as compared to the PNC and mortality. That is very important when people tend to neglect it when they talk about health in Guyana. So please proceed.
Thank you very much. And to all the colleagues in studio and to everyone looking in and listening, let me just say hello. And it's a privilege and it's an honor to speak um, to the diaspora, to our sisters and brothers in Guyana and everywhere that people are listening. Um, for those of us who have kept pace, by 1992, we recorded between 14,000 and 16,000 deaths annually in our small country. The number of deaths in Guyana today is between 5 and 7,000 annually. So by just looking at that raw data, you'd see that on an annual basis, we have reduced the number of deaths by approximately 50% or just over 50%. In 1990, our life expectancy had threatened to fall under 60. And to put it in context, in 1947, when Cherry Jagan started PAC, the life expectancy in our country was 47 years at birth. Life expectancy in 1950, in fact, had not improved from that 47. In 1964, the last year of the PPP government before the PNC became part of the government, the life expectancy in Guyana had reached 64. It was one of the most dramatic rise in life expectancy around the globe at the time, from 47 to 64 in a period of about 10, 12 years. And as I said, in 1992, we had been in jeopardy of falling below 60 again. So, in approximately 30 years, from 1964 to 1992, we made no improvement in the life expectancy. Um, the life expectancy today in Guyana is just about 71, with female life expectancy of 74 and male life expectancy of close to 70. So we have made dramatic improvement in terms of life expectancy. And that is because of a number of things. But one of the most important factors in increasing the life expectancy is that child mortality, which in pure numbers was about 2,500, between 2,200 and 2,500 babies. This is children under 5 years old, died before, well, died on an annual basis. Today, we have reduced that number to under 200. It's still too many, but a dramatic reduction from the 2,200, 2,500 on an annual basis to under 200. So that's the first reason why we see life expectancy at birth increasing. And there are several factors for that. We could discuss that later. The second reason for the reduction of the total number of deaths from around 15,000 to around 5 to 7,000 is because premature death from chronic diseases, this is like diabetes, cardiovascular diseases, etc., um, has reduced dramatically. Premature death, in this case, being deaths that occur in people because of the chronic diseases before the age of 70. Um, of- Going back to the early 1990s, the number of premature deaths reached up to 90%. The premature death from chronic disease now is around 27, 20 to 29%. In other words, a lot of people who would have died prematurely because of diabetes, because of cardiovascular diseases, because of cancer, are now surviving to a longer period and beyond the age of 70. Um, so that's the short story for Guyana, and sometimes it's a neglected area of looking at the overall health, because once overall health increase, your life expectancy increase. That's the overarching indicator for an improving health system. And we see it whether we look at the absolute number of deaths, or we look at the rate of deaths, or we look at life expectancy. We see it in Guyana. So I hope that gives a sense of the accomplishment of the health sector. Um, pre 64 under a Cherry Jagan government, a PPP government, and see the stagnation that occurred between 64 and 92. And since then, the significant improvement in how long people live, and in fact, the disability years lived. So I hope that provides some
Yeah.
clarification.
Thank you, Doc. Do you think the reduction in infant mortality is due in part also to the nutrition program that you have launched at the
Well,
hospital?
there are a number of reasons. One, at the time in the early 1990s, we used about 8 antigens for vaccination. Today we use 18 antigens. So the PPP was able to add more children vaccine that save lives. But in addition to that, the coverage for things like against polio vaccine, measles, mumps, rubella, diphtheria, um, so things like whooping cough and so on, were in this between 50 and 70%. Coverage is now close to 100%. For many of the 18 vaccines that we use, we have 98 to 99, 100% coverage. So that the PPP government, from the time it resumed power in 1992, made vaccination a priority. Michelle Jagan had declared, Bharat Jagdeo, Janet Jagan, Sam Hines, Donald Ramutar, and now Irfan Ali have all made a declaration that no matter what the situation in Guyana, no matter what circumstances force austerity measures, that we guarantee that vaccination will never be subjected to austerity measures. That we will ensure that our children have access to vaccines at all costs. And in Guyana, all these vaccines are free of charge, whether the child is born in the public sector or in the private sector. It is available for free. Um, and so these are tremendous achievements. And do not forget that for many years, Guyana won gold medal at the UN for vaccination coverage, at least 4 years when I was Minister of Health, and subsequent when Minister Barry Ramsammy was Minister of Health. One of the unfortunate things is that between 2015 and 2020, for a couple of years, vaccination rate for all of our vaccines dropped in the low 90s and sometimes below 90%. And over the last 3 years, we have recovered to get back to close to 100%. There were many stockouts of vaccines at that time. We are making sure that we never have stockout for vaccine. In addition, vaccines had to be lifted out from Georgetown to the hinterland whenever needed. Now we have cold chains across the country where we could uh, keep and store vaccines in the regions where they are used. Another factor besides vaccination is access to potable water, to clean water. We're making sure that people have access to water. And then ensuring that children survive at birth. And indeed, then and now, one of our challenges is to keep newborn babies alive. Because whilst I say that the newborn babies, that mortality in children under 5 is now under 200, most of them, about 150 of those, are in the neonatal period. This is babies that are less than 28 years old. And so, whilst in the interior and so in the past, you had, especially in the 80s and so, very high mortality rate. We've been able to reduce that because we have better care. And now, we've been at this on the 200 mark for several years. Now with introducing neonatal care, this is the neonatal ICU, what the so-called NICU, in many hospitals around the country. This is a new thing, right? It started when I was Minister of Health, and now since 2020, we are now extending NICU across the country. We never had NICU nurses, for example. Now we have NICU nurses. We're working with Mount Sinai, we're working with Northwell, We're working with McMaster University and Calgary University to ensure that our NICU nurses, that our neonatal doctors are trained more. We are making sure the facilities, so ventilator supported NICU are now beyond Georgetown Hospital. Now we're making sure that at Mabaruma we have, at Letem we have. And these are work in progress, but I suspect, not suspect, I expect that with a network of NICU across the country, that you will see by 2025 the child mortality going from about 200, under 200 to under 100 on an annual basis. And so we have made tremendous progress, but the number of babies dying prematurely, dying before 5, and particularly those dying before age 28 days, are still too high, um, even though there's been a dramatic decrease from the early 1990s.
All right, thank you. Dr. Sanjay, over to you. Your question for Dr. Ramsammy. Dr. Sanjay.
Well, good evening, everyone, and good evening, everyone. Can you hear me?
Hi,
We can
Sandy.
hear
How are
you.
you doing?
Very good, Doc. It's a pleasure to be on this program with you, and pleasure to be with everyone else as well. First, I would like to commend the PPPC government for, their continued support for the Guyanese population in terms of healthcare that we're talking about. A 50% reduction of death and improvement of vaccine delivery and vaccine storage in the hinterland region is applaudable. And I think that's has to be noted. Regarding further vaccinations and regarding further care, I know Guyana did an excellent job when it came to COVID and containing the virus with the new hospital and also vaccinating nearly 80 to 90% of the Guyanese population. So that was really commendable to the PPC government again. My comment on infant mortality, I know there's a specialty hospital being built. And I know you spoke well about the NICU training, the NICU nurses. And I just want to know, does Guyana have neonatologists? And is that person, I'm assuming with a couple hundred deaths a year, how are we evaluating what's happening and who's held accountable?
Okay, so good question. Neonatologist. I am very proud of the young doctors that are now neonatologists in our country. And so the answer is yes. The a qualified yes, because we need more. So there are a few neonatologists at Georgetown Hospital. Certainly Dr. Anna Florendo Chin, Dr. Sarah Singh, Dr. Winsome Scott, and a couple of other doctors. And in fact, right now in New York being treated, hopefully she'll be back home soon, Dr. Marissa Paris. So these are very young Guyanese women. Dr. Winsome Scott did her postgraduate in Guyana. All of them did. But then she went on to McMaster, where she became, she did a fellowship and became the head of their residency program. So these are high quality young people. We just need more. And we are also training neonatal nurses, as I said. But it gave me an opportunity to say this, that, and as you know, and I think all of our colleagues know, certainly Dr. Ramdas know when he worked with us for a short while at the Ministry of Finance. Um, the in before 2006, the only specialists in Guyana were either foreigners or Guyanese who had been trained in London or in Canada or in India. So we trained them one at a time. We had a handful of specialists only in this country, and mostly surgeons, general surgeons. Since 2006, we introduced a postgraduate program right here in Guyana. And today we train our specialists in 18 different areas. Um, so outside of general surgery, we have orthopedics, we have psychiatry, we have pediatrics, we have trauma medicine, we have OBGYN. So we have training in specialist area in a wide spectrum of clinical practice. Um, we need some more, and we need more of our young doctors to be trained so that we could send them to the regional hospitals. No, none of our hospitals should be without specialists. There's some greater needs. We need to train larger numbers of obstetrics and gynae specialists. We certainly need to train more trauma specialists. Um, Whilst we have 9 radiologists now, our imaging diagnostic specialists, we need more. 9 is not sufficient. You take ultrasound. Ultrasound at GPHC, up to the beginning of last year, we were doing about 400-500 a month. Now we are doing 4,000-5,000 a month. We were doing a couple of hundred CTs up to last year. We are now per month. We are now doing close to 2,000 CTs per month at the GPHC. And if these are going to be read by radiologists, that's an enormous burden that 9 people carry. In addition, we don't have what you are used to, which is having ultrasonographers that could do ultrasound and then leave the interpretation to the radiologists. Instead, it's the radiologists doing the ultrasound. We're fortunate in echo because in collaboration with Calgary University, we have trained echocardiographers, and they are able to do a better job, more well. The backlogs are much shorter in that area. But yes, so the answer is yes, we have neonatologists, but I took the opportunity to let Guyanese know that in many of the clinical areas, both for doctors and for nurses, we have specialists. And after they finish their specialist training, we also send many to do fellowships. Right now, there are 2 of our radiologists going to do interventional radiology fellowships at McMaster and at Dalhousie University. And we expect a couple to come to North Shore and to Northwell to do some training. Indeed, 3 of our gynecologists will be coming to Northwell to do fellowship in urogynecology. In order to deal, particularly in women, with the incontinence issue that middle-aged and older people have to endure.
Dr. Ramkisoon, follow-up question.
Yes, Doc. Thank you. it's great that we have all these Guyanese doctors being trained and coming back home to give. That's a
Well, most of the training is done locally, but as I said, some do come for fellowship. So what we do is a general specialist area in Guyana, and the fellowship, they come to do the sub specialities.
okay. That's a lot of training, I'm assuming. But real quick, how is this hospital, the neonatal hospital, the maternally fetal hospital that's being built? How is this going to
So
be structured?
okay, so what we are building, it's already under construction at a cost of 161 million US dollars, is a children and women hospital, um, dealing with the special areas that women um, have to deal with, but also ensuring that children overall um, will have a more sensitive area for dealing with children, um, take into consideration the special needs of children, and so on. Dr. Winsome Scott, who did a fellowship after completing her postgraduate study in Guyana, in McMaster, um, has developed management skills for that. And several of our doctors have been trained to take leadership role in that hospital. At the moment, there are 25 persons doing a master's in um, health leadership at York University. It's done in Guyana with the faculty from York and McMaster coming to Guyana. They should be graduating this year. In addition, we are training our nurses. There are 3,000 nurses that will be trained between now and 2025. Um, because we recognize we have to have staffing there. For those of your listeners, and Dr. Ramkisoon, you and others who know people that could teach ultrasonography, we would appreciate their coming and making a contribution as we introduce that course to train people. So we're making sure that we have the staffing that goes into running hospitals like these. This will be a level 5 hospital, meaning the highest level of tertiary care. It will have a cardiology department with a cath lab. It will have MRI. It will have an oncology department. Um, if there is one area that we have made only slight progress in, it would be oncology. We really need to, to focus a lot more on oncology. And so, whilst we have a long journey to go with all of the specialty area, I think the one that we have the longest distance to travel is oncology. This hospital will have all of that. This afternoon, early this afternoon, I concluded discussion with Mount Sinai and the pathology lab there. Um, I would say by October, Guyana should have one of the most equipped pathology labs in our country. It will be completely automated, and therefore we could use pathologists wherever they exist. So we could use a pathologist in India and China. We could use a pathologist at Northwell and Mount Sinai. The pathologist that might be in Jamaica or Trinidad, because everything will be online, like the PAC system for radiology and for imaging diagnostic, where you could view the picture on screens. You no longer need the microscope to do these things. and to look under microscopes. Um, so we are making progress, and that hospital will have the latest technology. We are working with the Europeans, we are working with our colleagues in Northwell and Mount Sinai, our colleagues in Vanderbilt, um, our colleagues in McMaster and Calgary and Dalhousie, to make sure that that hospital will have the support it needs. Um, but whilst we are building that hospital and the delivery date for that hospital, that was not intended to be a pun, but the delivery date for that hospital is 2025. Um, at the same time, there are 6 new hospitals being built, regional level hospital, level 4 hospitals, all with CT and so on, that will be built. Um, between Skeldon and Anna Regina. So there is a hospital being built at number 75. There's one being built at Bath Settlement. There, a third is being built at Enmore, a fourth at Little Diamond on the East Bank, a fifth at Dickenson in Region 3, West Demerara, and the sixth in Lima and Anna Regina area. Um, at the same time, there will be a New Amsterdam hospital. The GPHC will be redeveloped into a new hospital. All the hinterland hospitals will be reconstructed. Um, the Bartica Hospital will be reconstructed. The West Demerara Hospital will be reconstructed. So it's a massive transformation of the physical and technical infrastructure. New Amsterdam, in fact, will have a cath lab also, um, and MRI. So it's a physical infrastructure transformation, it's a technological infrastructure transformation. There is room for a lot of our diaspora sisters and brothers to come and contribute. Um, and so I'm looking forward to seeing more of our people coming and joining. Incidentally, as we are talking, we are working with a group of orthopedic surgeons in the U.S., mainly in Maryland, that has institutionalized um, orthopedic surgery such as hip replacement, knee replacement, um, the knee joint replacement. But at the same time, our transplant program is growing leaps and bounds. Um, Presently, Guyana's kidney transplant program, we do more kidney transplant than the rest of the Caribbean combined. And very few people seem to know that or recognize that. We are planning right now our first cadaveric transplant. So thus far, we have focused on live um, donation, that is a living person donating to another living person. Recently, we did our first paired transplantation, meaning a person who had a donor but no compatibility with the donor was able to exchange with another couple that had the similar problem. And so they exchanged donor, and those were done at the same time um, with the transplant team in Guyana. But very soon, we will be able to do cadaveric transplant where we are able to take from a brain dead person organs and transplant. And very few people realize that in the last 2 years, we have done over 200 corneal transplants. Our aim is by 2025 to establish an eye bank. Um, so, so tremendous work is being done. At the same time, however, whilst we are doing these big things and We are accomplishing far than people could have imagined. There are some little things that we need to get right also.
All
Um,
right, thank you, Dr. Ganga. Your question for Dr. Ramsammy or clarification?
First, let me say good evening to all of our listeners everywhere and in our panel. Um, and also, I thank Dr. Ramsamy for such a lucid explanation of the rise in life expectancy and also our success in kidney transplants. These are all important milestones and achievements. The thing that concerns me is the cost drivers creep upward. It's affecting all countries, and it will affect Guyana. So we need to identify what our cost drivers are, monitor it carefully, and disaggregate it in terms of hospital, ambulance, service visits, and emergency care. So these four areas would need to be monitored carefully. So can you update us on how the cost drivers are affecting our healthcare system?
Of course, investment in health is always a troublesome thing, right? We need to invest, but cost for healthcare is not cheap by any means. A lot of people ask us how we are able to afford the things we do. For example, everyone that have open heart surgery or any of the interventional um, things that need to be done, like stents, angiograms, and so on, at the Georgetown Hospital, is free to the patient. Um, and people ask, how could you do that? Because nobody pays anything. All medicines are free, all laboratory tests, imaging tests, all of the surgeries are free in the public sector. People ask us how we do that. Um, and indeed, recently, for patients on dialysis, we now give every single patient, and this year we expect over 400 of them will receive, they did last year, they will continue to do so now, $600,000, that's about 3,000 US, as a subsidy. Each one gets that. Um, some need more help than that, and they come back and they get that help. And that's not a one off payment, that's every year. And that's why it's so critical to develop the transplant program because you can't keep people on dialysis forever. Um, and it's important to see the kind of investment we make because I don't know how many people know, but in 2023, the budget for the health sector is $75 billion. That comes out to about 800 US dollars per capita on health. And it's interesting to know that the highest per capita in the equity question, that how much we invest in health for people in regions, the highest investment per capita is in regions 1, region 7, region 8, region 9, region 10. So let me repeat that. Regions 1, region 4, region 7, 8, 9, and 10. So the hinterland areas have the highest per capita investment. Um, it is also interesting to note, and for the diaspora listening, and it's unfortunate if a wider spectrum of the diaspora don't listen because we hear all these things about racism, all kinds of things. You know, if we compare 2014 to 2019, this is the last full year of the PPP in government before the PNC APNU AFC took over, and 2019, the last full year of the PNC APNU AFC government. You would find that in several of the regions, regions 1, regions 2, regions 3, region 5, region 6, region, yeah, regions 1, region 2, region 3, region 5, and region 6. The per capita income in 20, compared to 2014 in 2019 was lower. Um, and, and that must tell a story by itself. The truth is that the PNC was clueless when it came to health. But the drivers of healthcare is in Guyana is not different from the driver in the US. It's the chronic diseases. The chronic diseases create greater disability. It creates more than, so 74% of all deaths in Guyana are due to the chronic diseases. And more than, or close to 70% of hospitalization in Guyana is due to the chronic diseases. So you know where the drivers are in terms of healthcare, because the chronic disease also mean lifetime supplies of medicine, lifetime episodes of being in hospital, more laboratory workup, etc., more time spent in clinics, etc. Um, so you know where the drivers are. Um, how do we keep up with this? Well, I have to say this about the PPP, whether it's from 1957 to 1964, 1992 to 2014, or 2020 to now. There's one thing for certain, is that the per capita investment on health will increase. Um, and therefore, I think that whilst it's not perfect, what the people could look forward to um, is better health from a PPP government. That is not a debatable issue. Even people who are supportive of the PNC knows that. I think that, like Mr. Corbyn used to say when I spoke in Parliament, when he was leader of the opposition, you got to give Jack his jacket. The truth is that under a PPP government, health is always better. And health is better not only because we have the vision and the competency, but more importantly, we have visionary leaders who sees investment in health as an investment in development. There is no development without health. And health is not a mendicant that come to the government with hands out looking for another handout. That is an investment in our people, in our country, in development. Any government that ignores health ignores development. And so important, Dr. Ramdas, is that the drivers for healthcare and healthcare costs, we recognize, and that's why we are taking action. When you see we put up a diabetic foot program, it's not because we somehow find the people with diabetes and we love them that much. It is because it reduces our cost in the long run. So we are identifying the drivers, we are investing in these areas so that our overall cost of healthcare will come down. And every time we save money because of an intervention, we could invest more so that we bring more things. CT was not available in the public sector. Now we're talking about by 2025, at least 14 hospitals with CT. MRI was never available. Now we're talking about at least 4 MRI in the country by 2025. Um, Dialysis wasn't available. Now we are making sure that everyone who must have dialysis is able to get it. Um, Open heart surgery was not available to our people. Now we're talking about everyone who could get it right here. Hip replacement, hearing aids, spectacles for our children. These are all public good, um, but they're also drivers of healthcare costs. Um, and yet we see by investing in these things, our people are healthier, our people are more productive, and therefore we pay back. Health pays back for itself.
Okay.
I hope that makes it as clear as possible.
Dr. Ganga, a follow-up question.
Yes, just in terms of that alarming statistics, 24% of the deaths due to chronic diseases,
74%.
74, yeah, right? 74.
Yes.
Yeah. So I was wondering if we have mobile clinics to do some more screening so that we can bring down some costs. But I like your approach here. Find the people. That's excellent because you're going to touch the body, find out where the problem is. That's that. So what are we doing to find those people?
Okay, so we are broadening our screening program. In a few weeks from now, you will hear us um, introducing mass HPV testing for all persons 30 and above. More than 85%, 85-90% of all cervical cancer are due to HPV 16 and 18 in Guyana. Um, and therefore, if we could identify people who are HPV positive, we identify people at risk for cervical cancer and maybe other cancers too. Um, so we are going to be introducing HPV testing as one of the frontline interventions so that we could identify people at risk and pay more attention to these persons. And then support that by frequent monitoring and the introduction of things like pap smears, VIE, surgical intervention, cryotherapy, etc. For those people who have cervical cancer. Presently, we are trying to put in all of our primary healthcare centers. These are health posts, health centers around the country, HbA1c measurements, so that we could identify earlier persons with diabetes. We do foot screening across the country. This year, we expect to screen every child for vision and for hearing. Just broadly introducing screening earlier and wider so it reaches people wherever they live. We have presently 4 telemedicine pilot sites in remote villages. Those of you familiar with our geography, you know, Guns is a very remote village, Yupukari, Napi, remote villages where we have telemedicine center. And just today, we signed off a contract to extend those 4 to, to 19 sites in regions 1, 7, 8, and 9, so that even if our specialist doctors can be available physically in those locations because we have ECG, ultrasound, HbA1c, and other screening and diagnostic tests. We are able to link the patient with the doctors at GPHC. Since December, we know at least 2 children and 2 adults had this not been available would have died. So yes, screening is a critical tool, and we are making sure that happens. Incidentally, Um, 3 mammography machines are on their way to Guyana to add to the one we have at GPHC, so that we could screen women. We are about to launch a massive breast screening program in collaboration with McMaster. We already have a cervical screening program that is reaching people nationally. But these are some of the things. We are educating men about prostate. Um, it is a lot of work that is going on, and I know that you don't have as much time for us to talk, but I hope I'm giving people a glimpse of the exciting things we're doing in Guyana.
Yeah.
Whilst we're not perfect yet,
All
um,
right.
we are
Thank you,
making
Doc.
great progress.
Thank you.
We have a final question on tertiary care by Dr. Ramkisoon. Please make it as brief as possible.
Sure, sure. Thank you. The talk is more for tertiary care. And when I think about tertiary care, a patient comes to my mind, a patient from Crabwood Creek with chest pain
Yes.
that can leave Crabwood Creek and can get to a specialized hospital with chest pain, get a cardiac cath, diagnose. If stent is needed, it's needed. If not, that person can get open heart surgery and get follow up care all in one house, one hospital center. When we talk about tertiary care, this is the kind of caring that I'm thinking about. Also,
And we are thinking of.
but we have this in place. We have the
Yes or
necessary things.
no? You talking about Crabwood Creek, the hospitals in Region 6.
I'm from
Um,
Crabwood Creek, that's why.
yeah, that's fine. I mean, but whether it's Crabwood Creek or Anna Regina or Linden or whatever, um, the hospitals in those areas now have ICU. New Amsterdam have some, so they could provide some treatment, but not the kind of tertiary care that you described. Now, most of these patients, once they receive some treatment, so let's take that particular case from Scrabble Creek, would end up in New Amsterdam. Depending on how serious that is, they might manage the patient there for a little bit and then refer to Georgetown Public Hospital. A patient at Georgetown Hospital will receive most of what you just described. So the cardiologists would manage them. If they need an angiogram, they can get an angiogram in real time. If they need a stent, they could get it in real time. Where the spectrum of tertiary care that you describe stops in Guyana is if there is need to move the patient for an open heart surgery and that grafts are needed. Um, we don't have a routine service for that in Guyana. We have a team that comes in every month, every other month, a team led by Dr. Gary Stevens, that most of you know, who comes to Guyana. In 2006, as Minister of Health, Gary and I put together this program, and thousands of people have benefited from it. This is the last part of the development in the cardiovascular program that we need to develop. Recently, Dr. Pradeep, a Guyanese who studied um, adult cardiac surgery in India, returned home. So, working with Dr. Stevens, working with our colleagues in Calgary, in McMaster, and hopefully with Mount Sinai, we will be able to develop a routine program where we don't have to wait for the surgeons to come from outside of Guyana to do open heart surgery. So the tertiary care that you described is available at GPHC. Um, However, It is not full because if there is need for a real time open heart surgery, um, we don't have that right now. A couple weeks ago, we had
Work,
8
work in progress.
pediatric surgery done in Guyana. It was done by a team from Canada. Um, so, so yes, it's work in progress, and if we have our way in Guyana by next year, we should be able to say at least at GPHC that we have that tertiary care that you described. And hopefully
I don't mean to
soon
inter-
after by 2025 in New Amsterdam.
All
I don't
right.
mean
Thank
to
you very
interject,
much. Thank you
but
very much, Doc. I think we have to come to an end.
sure.
Over to Shamiza, our host.
Um,
Shamiza.
I believe Dr. Ramkisoon wanted to follow up.
Just a
Okay.
quick point. Many folks in the diaspora who are coming back home, they have had advanced cardiac procedures. They have had open heart surgeries. They have defibrillators. They have pacemakers. They have Watchman devices, and these folks want to come back home. They want to go visit Guyana, but many times they're afraid that if they get sick in Guyana, who will be caring for them? If you can address
Well,
this
I think
last minute, I'm
that
sorry.
that was a real fear many
Yes.
years ago. But I think now that we have 4 interventional cardiologists, one of whom is in New Amsterdam, Dr. Court in New Amsterdam, but Dr. Chin, Dr. Haynes, Dr. Mahendra, Dr. Pradeep in Georgetown are able to provide that kind of service. To manage patients who have pacemakers and so on. So we need more, and we need more in the regional hospitals. But unlike 2006, 2010, when you come to this country with those kinds of conditions, you are at risk
Right.
because there was nobody to take care of you. We now have at least 5 doctors.
So
Um,
now is the time for them to visit.
Now is the time to visit. Now is the time to start
Okay.
taking
Shamiza.
back your homes.
Yes. Thank you.
Shami.
Uh,
Shami.
Thank you, Dr. Ramsammy. We will now take a couple of questions from our viewers. We have Shankar Ram. He says, you may have the doctors, but do they have the tool to carry out all the procedures to be done in Guyana?
So the answer is we have more today than we had in 2020. We certainly have more today than we had in 2010 and 2000, but we don't have everything. Um, whilst there's an MRI in Guyana, we need an MRI at least in Georgetown Hospital, MRI in New Amsterdam. We about 25% of our surgeries at the Georgetown Hospital are done by laparoscopic surgery. Um, we need more laparoscopic equipment so we could do more modern surgery. We certainly could benefit from having more cath labs. So yeah, we need more tools. But I think Dr. Ramkisoon said it's a work in progress.
Absolutely.
We have much more than we had before, and it will surprise you how much more we have. Well, when people come and they see, they are really surprised what we are doing.
Thank you. Vicky Prasad is asking, on top of all your great plan you have to implement a better future healthcare, what are your views on educating people to obtain safer jobs, increased health literacy, take preventive healthcare measures, avoid riskier health behaviors, and demand better quality healthcare services?
Okay, that's a mouthful.
Absolutely.
So yes, as I said to an audience today, we could have the best doctors, We could have the best hospitals. We could have the best technology. However, if we don't have an aware population, we will always be behind the curveball. We need to make sure that we have an aggressive, a robust, aggressive education and awareness program. There are women living with incontinence and believe that's a natural outcome of aging, when in fact a simple surgery could resolve their problem. There are men who are suffering because of prostate issues. And I keep simple lessons that people know that, yeah, I have to go to the doctor. Um, those of us boys who grew up in Guyana know standing up on the bridge and see who could pee the forest. And then you get older and you stand above the toilet bowl and you still don't make it. And you know you have a problem, one of which might be prostate. We're trying to educate people what to eat, um, when to eat, exercise, teaching people, um, reproductive health, safe sex, all these things that we need to teach people. And whilst we are doing a lot of what you do in the United States of America, um, just like you're sometimes losing the battle there, find we're sometimes with all the effort we make, we're not getting as much. But I recall when I was Minister of Health, every kid used to sing a song, What Am I Without My BMI? Um, and that's because we had made that a very popular thing. We have to popularize these things again. Education and awareness is critical component of a better health care. In terms of quality, we have done a lot to hold people accountable, to make sure our healthcare is delivering a higher care. In a few weeks from now, 2, 3 weeks, we have a high level team coming from London and from Canada and the US that will be working with us on our key performance indicators as we try to develop a higher quality of care for our people. Um, and so, yes, we are working on a broad scale for all of these things. Um, but, we still have our issues. And for my sisters and brothers who know some of the issues we face, let me say this. There are very few of you can identify all of the weaknesses we have, like I can. Um, and so I think we are working hard to improve quality of care for our people and to teach our people to take responsibility for their health care.
Last question, it comes from Ramona. She says, in case of diabetics, would provisions be made for special medication if there is insulin resistance involved?
The answer is yes. So in Guyana for diabetics, and certainly we don't have some of the things you have in America, some of the newer medicines like Jordans and so on. But we have all of the traditional medicines available. In the case of people who sh- who say metformin don't work and they have to have insulin, but they are resistant to insulin because of receptor issues and so on. We do have alternative treatments. So we sometimes have those procurement issues, but um, the uh, provisions have been made. And as we get more efficient in procuring these things, you will see better care for our people.
Thank you. And for your closing remarks, please go ahead.
Well, first of all, let me thank you for giving us the opportunity to talk about health. The president of Guyana, His Excellency President Irfan Ali, has said that health is the epicenter of our development strategy. We recognize that whilst we have done a tremendous job as a PPP government from 92 to now, that we are still a work in progress and much needs to be done. Whilst we have trained more people and we have more specialists, we still need help. And that is why we reached out to people. The health of our people is immensely important. Our goal is that our life expectancy will surpass 75 by 2030. Our goal is that our life expectancy is no less than the average life expectancy in CARICOM. Our goal is that our life expectancy in Guyana will not be very different from the United States of America. So health is the center of our development trajectory. Um, and we want to make sure that those who live longer could also live disability free. And one last point, women should not die from childbirth, and children should not die before they're 5 years old. So that those are our overall overarching goal. We will continue to invest. We will continue to work to be more efficient and to be more responsive to the needs of our people. Thank you all very, very much.
Thank you,
Thank you
Doc.
very much to all our viewers this evening. Thank you for taking the time to be here. To our entire panel, thank you so much. Dr. Tara, thank you. Dr. Leslie Ramsammy,
Thank, thank
thank you
you.
so much. A lot of information was shared tonight, guys. Please continue to share the Guyana Dialogue with your friends and family. Important information that can save many of you. So please continue to share our program. Uh, Thank you so much. It has been a pleasure spending this time with you. Until next time, this is the Guyana Dialogue, and I'm Shamisa Ali. Good evening, everyone.
Good evening. Thank you.
Good evening. Thank you.
Thank you, everyone.